Hi, I'm Dr. Pickworth, and I'm one of the physicians here at Northwest Integrative Medicine. So I love all of my patients, of course, but I love working in mental health. I've brought it up already. I have experience of the full sort of spectrum of mental health disorders and diseases, including people who are experiencing mild mental health symptoms that they want a little bit of support for, maybe some anxiety that's situational or depression that's situational, all the way to people who are experiencing psychosis and more significant mental health conditions. And I love to work with the full spectrum of mental health conditions. When it comes to my people, on top of mental health, I love working with bigger bodied folks, individuals who have maybe not been treated super well by the medical system. I hope to help to heal their relationship with healthcare a little bit, because I've walked the walk too, and it's a challenge, and I like to be able to be there for marginalized communities, including bigger bodied people, as much as possible. So along the same lines, highly sensitive individuals who are neurodivergent or otherwise identify as neuroatypical, I love to work with as well and meet them where they're at. And then individuals who've been experiencing pain that they want to get to the bottom of, I also like to dig into that with them as well. Well, I love people, so being able to spend my days with new people and building relationships with them is so awesome. And I think that my patients would agree that my relationship with them is important. I believe that the full naturopathic scope includes pharmaceuticals, and that it's part of our treatment paradigm, and that they're important and needed. So working especially in mental health, I believe that there's a time and a place for pharmaceuticals, and there's a time and a place for all the other amazing alternative stuff that supports the system, that supports the brain, the body, the emotional body, and that working with the patient to meet them where they're at and accommodate their preferences is just a really cool thing about naturopathic medicine. We have all these tools in our toolbox that we can use. Well, I do think that my research background is something unique that I bring to the table. Having been trained at the National Institutes of Health, I do think that my standards for research training are really high, and the way that I'm able to evaluate research and bring it into my clinical world is just kind of on a different level than a lot of other providers, just because of my experience. I also am someone who focuses so much on creating a safe space for patients. I want them to feel like they can be themselves and bring their whole self to the visit with me every time. And being able to validate them and sit with them in their experience is something that I think I'm pretty good at. I also am a person who lives in a bigger body, and there aren't a lot of people like that in our community, and so I think I'm able to meet individuals who fall into that category on a different level and see eye to eye in a pretty special way. Well, one thing I do want to say directly to future and current patients is, if you're someone who lives in a bigger body, I want you to know that your weight is not the issue, and that there are things that we can do together to focus on your health and your experience in your body that will hopefully allow you to bring some peace and quiet.